Okay, welcome everyone. We're so glad you are able to join us. We hosted a live session of searching for Indigenous health information yesterday and had trouble with our recording. So we're re-recording a duplicate session. So if you missed it or if you loved it so much, you want to watch again, this is absolutely for you. So I am Orvie Dingwall, and with me is Gail Matheson, and we are librarians for Manitoba's Health Information and Knowledge Network. And we're excited to talk today about searching for Indigenous health information. And you don't need to know the details of Zoom because we're just recording. But we'll start today with the land acknowledgement, recognizing that both Gail and I join you today from Treaty 1 territories. And Gail and I both are librarians at the University of Manitoba. And the U of M campuses are located on Anishinaabeg, Inanuak, and Sinunuak, Dakota, Oyote, and Dene, and the national homeland of the Red River Métis people. And throughout today's session, we're going to be emphasizing with Indigenous health information that Indigenous, Métis, and First Nations and Inuit people are all involved in creating those resources, in using those resources. And Gail and I just want to recognize that we are both settlers, but part of our commitment to reconciliation is to do our part in sharing this kind of information that is part of our jobs to share, and part of our jobs to make available and make Indigenous health information accessible. So with that, today we're going to make sure you know all about MyNet's library services. And then Gail's going to go deep into the truth of Indigenous healthcare and cover Indigenous research methods, data governance, how to search for all of this. And then I'll finish us out by talking about how we can ensure the information that you're looking at, you're taking a critical appraisal approach to it. So MyNet, Manitoba's Health Information Knowledge Network, is provided by the University of Manitoba's Health Sciences Library to staff of Manitoba Health, fee-for-service physicians in Manitoba, and staff of participating regional health authorities. So these are those regional health authorities. If you're located in the city of Brandon and you're not sure what your access looks like, just message us and we can review that with you. Our team includes Gail and myself, as well as 3 technicians, and we're part of a larger outreach group that also provides services to the Kivalliq region, as well as the WRHA here in Winnipeg. So if you don't have a library account and you fall into one of those groups, then definitely visit our website and register for your library account. They are free. And our core services involve literature searches. Gail and I are happy to conduct searches for you. Any article or book or resource that you're interested in, we can get that to you. So never go without and never pay to access articles online. This is all part of our service. We do education sessions like the one we're doing today. And we're also happy to create custom education or orientation sessions for you and your teams. And we also help with current awareness. There is a provincial license to UpToDate, which is a clinical decision support tool. And these are all part of MyNet's library services. And with that, I'm going to turn it over to Gail.
Great. So just starting off with the truth of Indigenous healthcare. So Truth and Reconciliation Commission talks a lot about the beginning part being the truth. And we don't hear a lot about the history of Indigenous healthcare in Canada. We've learned a lot about residential schools over the past few years, but we haven't really talked about Indian hospitals and Indigenous healthcare in Canada and the history of it. So I thought it was really important that we shared a few resources on the history of Indigenous healthcare in Canada. These are 3 books.
And you can access them through us if you want us to send them to you. You just send us an email and we can get you set up. They also seem to be available through the public library. And you can use their Libby app to get access to an ebook if that's something that you normally do. So you can find access that way as well. Just go back 1 second. And if for some reason you don't have enough time to read the books in their entirety, there is a webinar. So the webinar from the National Collaborating Center for Indigenous Health. They have Maureen Lux, who's the author, giving a session on an overview of separate beds, a history of Indian hospitals in Canada. And I would highly recommend that webinar. Yeah. And then here are a few more resources. Alberta Health Services has a short video on the history of Indian hospitals, and then a few other resources on racism in healthcare in Manitoba that are really good reads and listens. So thinking about the differences between an Indigenous approach to healthcare, this is a graphic produced by the Métis Nation of Alberta, showing an infinity with no beginning and no end. And it has some different concepts from maybe our normal healthcare system right now, like on the land programming, intergenerational programming, cultural programming. So it shows a holistic approach to healthcare. And the National Collaborating Center for Indigenous Health also has another webinar that Visioning the Future has a discussion by Indigenous leaders on future priorities for Indigenous healthcare. And then this graphic is from the First Nations Health Authority. So again, looking at a First Nations perspective on health and wellness. So starting in the middle with the human being and everybody being responsible for their own well-being. And then outside, the physical, spiritual, mental, and emotional health being important aspects of a holistic health. And then wisdom, respect, relationships, and responsibilities being impacts of health. And then family, land, nations, and community being our connections outside of ourselves that also play a role in our health. And then overarching environmental, cultural, economic, and social. So looking holistically at what makes a healthy individual. And they have more information on their website that I would recommend checking out. So then really important to think about data governance as well. I'm just realizing that I have my quote that I wanted to read. Bear with me 1 second. So data governance, thinking about statistical data, information that research that's been done with Indigenous populations, and data governance and data sovereignty, having ownership and control and access over that data, and thinking about the history of that research. So this is a quote from Nathan Obed, who is the president of ITK. And he says, researchers have enjoyed great privilege as they've passed through our communities and homeland using public or academic funding to answer their own questions about our environment, wildlife, and people. Many of these same researchers then ignored Inuit in creating the outcomes of their work for the advancement of their careers, their research institutions, or their governments. And this type of exploitative relationship must end. So thinking about data in terms of how it's been collected is really important when you're looking into the different research that you are going to be using. So there are a number of really great resources that you can look at determining data governance and data governance strategies with Indigenous peoples. And so thinking about that Indigenous research method and Indigenous approach, using things like nothing about us without us, data sovereignty, ensure everyone is counted, and that again, holistic approach where everybody is being considered. So then a few resources on the challenges with data and statistical information. So in the first resource there, one of the biggest challenges is the identification of First Nations respondents. So when you think of consistency of language over, the past 5 years, the changing in the terminology that we've been using, Indigenous, Aboriginal, and how that has impacted the data, whether or not First Nations were even considered in the research at all. And then another really important aspect being the coverage and non-response. So this quote comes from the document, hesitant to participate in data collection activities due to historic systemic misuse of data and research. And I would go further to say racist practices and abusive techniques that would create people not to want to participate in research. So thinking about those that aren't participating in research, how that will affect the outcome of certain studies. And then the second resource on that slide, it talks specifically about census data and the challenges with census data. So prior to 1981, only paternal ancestry was reported. So again, wiping out those maternal connections and that assimilation into colonial society. Altered meaning when translated into local languages, lack of respect for relationships between researchers and communities, and research not reflecting community priorities or Indigenous worldview. So lots of challenges with historical research and data that's been collected, and something that needs to be thought about going forward as well. So 2 places where you can get data and statistical information. The First Nations Information Governance Center. Their Knowledge Lodge has access to a number of surveys and data sets that you can go in and use. They follow OCAP principles, so ownership, control, access, possession. I think they have even a lot more data than what they're making publicly available. Access and control over data is something that is really important when thinking about OCAP principles. And if you are doing a research project or you're interested in other data, I would encourage you maybe to reach out to them because they may have other data that they don't have publicly available. That doesn't mean that they would necessarily share it, but they would be a good place to reach out to. And then Statistics Canada, on their website, they say that they have an Indigenous liaison program that serves as a bridge between Statistics Canada and First Nations, Métis, and Inuit communities. So they are making steps towards consultation with Indigenous peoples, but again, lots of caution using historical data and comparing between historical statistics with Indigenous communities. Okay, so getting into searching and search strategy. Typically in medicine, we encourage the use of the PICO to help formulate your research question. So thinking about population, intervention, comparison, and outcome. And when you're thinking about Indigenous populations, that will usually affect that population and the intervention part of the question. So one of the most important parts is creating a word map and figuring out what terminology you're going to use. You can use some of the documents that I've shown already, some of those Indigenous approaches to healthcare, those models to flush out some of the language that you may want to incorporate into your search strategy. So thinking about different populations, you're going to want to include a lot of different kinds of terminology. Unfortunately, when we're searching and doing research, we have to use a lot of outdated terms. We have to include racist terminology. There's racist terminology in our subject headings in library science. So we have to think about all kinds of terms that may have been associated with different populations. The Indigenous Peoples Terminology Guidelines that's here has a number of terms, what would be acceptable to be using today, what would be considered racist terminology, but it can help you figure out what you're going to use in your search strategy. And one example would be Inuit. We use the term Inuit in Canada. The term Eskimo is considered a racist term. However, even within the past 5 years, I've seen research coming out of the United States where Eskimo is right in the title of that particular study or research paper. So if you want to be comprehensive and include as much as we can, we're going to have to include those terms in our search strategies.
Gail, can I add just one thing?
For sure.
Which is that libraries are definitely working to update the terminology and have those outdated terms, and certainly the racist terms, so that they map to more current, more appropriate terms. That work definitely is going on. But also just recognizing, especially if anyone is searching for older resources, that searching by text words, you have to, for them to match, you probably need to use those more outdated terms. So recognize it is for the problem and the situation for what it is, but do make sure you're using not just current terms, but older ones as well.
Right. And then other aspects, like thinking about that intervention, incorporating things like land-based, traditional knowledge, elder knowledge. So, and as you go through, you may find other terms that may be helpful. Help you flush out what you want to find. And so really thinking about growing that word map as you go through in your research. And then again, you're also going to find that you might have to target search certain organizations. So there's lots of grassroots organizations and Indigenous health organizations that are putting out really great information, but you may have to search them specifically via Google. So again, trying to create a list of different places is also really helpful. So once you have all of your terms kind of figured out and you've got your research question, then you're figuring out where you're going to search. So academic databases will typically index things like from traditional publication channels, things like books and journals and conference proceedings. And often a lot of Indigenous content is missed because it's in that gray literature. And many Indigenous health organizations, like I said, are creating really great content, and it's not indexed in those databases. So as I go through the different places, I'll talk about what you can find in the different databases going forward. So I'll just talk about some maps that might be really great to use to help find some more search terms. Then I'll talk about iPortal, PubMed, OpenPolar, Google Scholar, and Google. So Native Land is a great website that you can use to look at nations geographically. So you can zoom in on a certain geographic location and it will tell you which nations are on that particular land, what the traditional lands of those particular nations, and the different languages that they may speak. So it can help you find spellings and different terminology that you can use in your searches. And then there's also the First Nation Profiles interactive map that you can locate different Indigenous communities in Manitoba. And they have contact information there as well for them. So then iPortal. iPortal is a database that is created in the University of Saskatchewan. It started in 2006 and it has about 71,000 records. This database, it's in-house. They incorporate gray literature into it, as well as articles and books. So everything in here has an Indigenous focus. And I'm just going to share my screen here and I'm going to so you should be able to see my
Yep, looks good.
iPortal. Okay. So you can see it's interdisciplinary. There's many different subject areas, but you can see health and well-being here. There are a number of options that you can choose if you want to narrow down using their options. But you can also just start searching. So we'll just type in a few terms. And with this database, you have to use Boolean operators, which are the and the or. So in this case, we're going to look for diabetes and the term Ojibwe. And there's multiple spellings for Ojibwe, and there could be other terminology as well that you might want to include. So we're going to use an or to make sure that it's pulling out both of those spellings. And so then you can see our results. It's only found 3. But then you can click into the resource and it will give you information about that particular resource. And then usually I won't click, but usually there's a full text. In this case, not sure if this will take us there. No, but if this article looks good and you would like to view the full text, all you have to do is you can send the URL or you can just grab the citation information and send that to us and we will send you the full text of that article. There are also limiters on the right-hand side here. If you have a number of results, you can usually limit by date. Because we know everything has an Indigenous perspective in this database, we can also just narrow down by a condition or treatment and see what we get. And then here you can see we can narrow down by date. One of the limitations with iPortal is because it is in-house, the frequency at which things are updated, it may not be as frequently or as often as something like Medline or Google. So we can see that there's 71,000 results here. But then when we look at our dates, we only have 96 from 2024. So just something to keep in mind. that it's continually being updated, and but it's still a really great resource to be using. So the next resource that I'll show you is PubMed. So PubMed is, oh, actually, I think here. PubMed is through the National Library of Medicine. They have 37 million citations within this database. It's a medical database, so it's not specific to Indigenous content. There's tons of stuff in here. This is, as I was saying, things that are indexed from traditional publication channels. PubMed has things that are published through those traditional channels that are being indexed. But you can do the same kind of search. We can do see what it brings up for Anishinaabe, and we get 9 results. Limiters, again, quite often with Indigenous content, you don't have to use the limiters, but if you end up with a lot of results, you can use date, and you can also use article type to kind of narrow down. You can search by search more broadly, and maybe Manitoba. So there's Manitoba content in here as well. So again, looking at that word map that you've developed and the different terms, and you may want to include a number of different Indigenous nations into that, and different terms with that or between, and really flush out that search strategy with PubMed. So the next one that I was going to show you was
Open Polar.
Open Polar. Thank you. Oh dear. So Open Polar. This one's interesting because it has geolocation information for some of the articles. So again, same thing. You can search for a topic. Even though it says Open Polar and you think it's all circumpolar data and circumpolar research, there is a lot of stuff for Manitoba in general. So you may find things for other groups other than Inuit within this database that may be worth looking for. So you can search. Your limiters again are going to be on the right hand side here. You can limit by date. And again, if you run into where you can't access something, just send us the request, and we can help with that. Maybe try Canada, geographic, and we can narrow down the results a little bit. So if we click into the Arctic, it will allow us to search with this map. And not everything has a geotag, and there are some mistakes if you're clicking through, but you can draw a search box and it will retrieve the research that it has from that particular geolocation. Sometimes it takes a few minutes, and then it will plot them on the map for you, and you can click through to find different research studies. If that's something of interest, you can do that too. Okay, so then I'll show you Google Scholar. So Google Scholar, again, it indexes research that has been published through traditional channels usually. It is one of my last resorts. If I want to know how much has been published on something, I'll usually go to Google Scholar. If there's very little published on something, it will give me the sense as to whether I'm in the right direction or not. But again, you can use that word map to search within Google Scholar, and it will give you all kinds of results. Let's see, in Manitoba, and you can be pretty specific, and it will show you. So it's pulling up things from MSpace, so different theses. It's pulling up journal articles, you can see, and there'll be book data, but not websites. So you have some advanced search options with Google Scholar. So if you click on the 3 lines there, you'll get an advanced search option. And then here you can, sometimes I'll use in the title of the article that can help narrow down, or you can also change your date range here. And there's a few options that you can play with in Google Scholar. If you run into a paywall for anything, again, request something through MyNet, and we're happy to get you the full text of things. Then probably the best place, my favorite place to look is Google, to be honest, because this is where a lot of your you're going to find a lot of your gray literature and different Indigenous organizations that have content that are published on their websites. So I'll just, and right away you can see we've got government websites. This is an article from PubMed, Diabetes Canada, National Collaborating Center for Indigenous Health, lots of interesting things. And the more Indigenous terminology, the more specific you can use, the better, because you're going to weed out some of the things that maybe don't have Indigenous community consultation. In Google, you have some different options, that advanced search options that you can use. So if you go to tools, you have an advanced search here. And I like to limit by file type. And because often a lot of reports and guidelines are written in a PDF format. So if you choose that option, what it will do is it'll bring all the PDFs to the top, some of those reports that might be really helpful. And it may be helpful to broaden out your terminology too, to find those PDF reports. Then there is another option that if you want to target search some of those Indigenous organizations, I'll just take the format off, but then you can search by a site. So we will put in the National Collaborating Center for Indigenous Health. And when you put in your site, you want to have kind of the biggest, broadest site, like the homepage. If there's slashes at the end, then it usually won't work. And then you just have to kind of bring it back to your .ca or your .com in order to get it to work. And then now everything that it's found is through the National Collaborating Center for Indigenous Health. And then maybe you want to take out some of the narrower terms and just do diabetes. And then you can kind of target search that certain organization for those resources. And now we have a lot more results. Quite often I'll end up going quite far into the results, scrolling to try and find things, because you can find good results quite far into the results list. You don't have to, I don't normally stick to the first page there. So that's all of my tips and tricks.
Amazing. Thanks so much, Gail. And yeah, so many really great resources to check out and so many great tips on how to search. And now I'll just do the closing segment, which is about once you've found some information that you think is the type is of interest to you and is what you were looking for. Really important to always critically appraise what you found before you put it into practice or before you believe it as truth. And specific to Indigenous research, there is this really great toolkit that has a checklist. And definitely recommend it. So there's a bunch of different parts to it. The first one is about validation and verification. Lots of talk here about community. Has this work been validated by the community? Have community members been involved? Are they Indigenous? Or the researchers identified qualified in conducting research with Indigenous communities? And then, so that's part one. Part two is about the evidence. Part three is about cultural respect and competency. So this is a really comprehensive checklist to go through. And depending on what you are doing and what you're using depends on how systematically you're going to go through this information and how many yeses or nos you need. So there's no magic number. Like if you have 5 out of 6 yeses, then it's okay to use or not. It's more to point you in the right direction, whether depending on what you're doing. So if you're creating an Indigenous health program, you're really going to want to be sure that you're checking all the boxes in the yes column. If you're just looking for some background information, you might have more flexibility in the yes and no's, but definitely recommend this critical appraisal toolkit piece. So next, just want to add caution about artificial intelligence right now. So when Gail was searching in Google, sometimes, I don't think we saw it just now, but sometimes your first result will be something that has been generated by artificial intelligence. And so really just a caution in all critical appraisal, whether it's Indigenous health or whatever you're doing, really take caution if something has been created by AI. Now, on some things, it's really great. Like if your iPhone is being glitchy and you're looking on a way to fix the bug, AI seems to know the answer to that question. For things that you really need to ensure are evidence-based, that pertain to any kind of health information, and certainly that pertain to certain communities, including Indigenous, Métis, and Inuit communities, then really take caution with what AI has generated. When you search for AI generated content, it doesn't, or when AI creates new content, it doesn't create the same information. So it's not replicable, and it often makes up its own citations. So you might find that you, and we might be the ones who help you identify this. If you're looking at a reference list and you're like, great, it provides all these references from all these books and journal articles, this looks really great. AI is notorious for just making those things up. So really taking caution, anything created by AI, and not that it's all bad and not that it's all wrong, but you just need to be very clear about what it is you're looking at and who or what generated it. My favorite, if you've been to any of our sessions before, you know my favorite critical appraisal tool is the CRAP test, because it's really straightforward, really easy and quick to do. So it's a really great starting place for critical appraisal. So CRAP is an acronym. The C is for currency. So you're looking at the publication date. Depending on what you're searching for, it might depend on what's going to be current for you. So if you're looking for information on the current avian bird crisis, you might only need information as of today. If you're looking about things about the history of vaccine schedules of infants, you might need to go back as far as there is to go, and publication date you might need to ensure spans a wide topic. So whatever you're looking for will be a little different each time. The R is for reliability. So this is where you're getting into questions like, is what I'm looking at supported by evidence? Have they included references? Are those references actually real? Has this work been peer reviewed? Have the references been peer reviewed? And is this perspective providing a balanced opinion, or is it primarily about one opinion? And if it's only primarily from one opinion, then great idea to search specifically for an opposing or a broader opinion. The A is about authority. So with Indigenous health resources, the nothing about us without us philosophy. So making sure that Indigenous communities have had a voice in the information created. Even on authority, just who is the author? Who is writing about this and what is something about them? And then finally on P, what is the purpose or the point of view of this resource? Is it to spread propaganda? Is it to provide quality evidence? Is it biased in what it's doing? So looking at that. So it's really quick just to go through those, and then you can assess whether that resource is going to be an appropriate source for whatever it is that you've been searching for. Other things you want to make sure you're thinking about are, is the information at the right level for your needs? So if you're looking for something for students in grade 4, a health resource for them, that's going to be written at a very different level than if you are providing an education session for nurses in your hospital. And not only just the right information level, but the reading level, the language of it, the accessibility of it, all those kinds of things. And also making sure that you've looked at a variety of sources and perspectives. And so Gail's presented us with a number of different places that you can check out to make sure you're getting a variety. And sometimes just a quick telltale sign is if there are spelling, grammar, or typographical errors. And again, sometimes it doesn't really matter, but other times you need to make sure that it's coming from an authoritative source. And so, I mean, sometimes there are quality resources that maybe have been translated or have been written in somebody's second language, and so they might have spelling or grammar errors. So it's just, again, it's a good when you're just providing a cursory overview of what you're looking for. These are good things to keep in mind. And new as of this month, we're also being very wary about information from the United States, and just questioning whether the sources have been impacted by recent orders by the US on federal agencies and initiatives. And this is looking at things like yesterday morning, and I specify the time because things change sometimes hourly. Yesterday morning, there was a mandate that there was to be no health research funded on that was exclusive to women. So if you had the word women or women in your grant application, it was not to be advanced at all. And so that just by nature is a biased perspective. And so we know lots of US sites aren't updating their information. They've been banned to post on certain topics and subjects. So really taking the US situation as really a crisis in the moment of health information, and just being wary of how and why information is being produced or not produced in this moment. Finally, and we'll have these available to all of you, These are some links to some great library guides and resources, including on our MyNet website. We have a toolkit for Indigenous health. The University of Manitoba libraries also have some really great resources. Many of the resources that you can click through to are freely available. But again, if they're not freely available or if they're only in print form, we absolutely can get those and loan them to you. And at our library, the Neil John McLean Health Sciences Library, it's located at the Bannatyne campus of the University of Manitoba, which is beside the Health Sciences Center. If you're in the building or in the area, definitely stop in. We have a beautiful space and one of Canada's preeminent Indigenous health collections. So it's really worthwhile to come if you're interested in Indigenous health resources, just to come and browse through everything we have here. So that brings us to the end of our session today. You're welcome to contact us anytime, and we look forward to helping you with your Indigenous health searching, and we appreciate you taking the time to attend today.
Thanks.
Anything in closing, Gail?
No, that's great. Yeah.
Okay, take care, everyone.
Bye.